Good afternoon, everyone, and Happy New Year. Thank you so much for joining us today for our webinar. And we are happy to welcome you to our first webinar of 2021 for the Maryland Rural Opioid Technical Assistance Project. Maryland ROTA is part of a Substance Abuse and Mental Health Services Administration initiative, and it is based at the University of Maryland in College Park and conducted in partnership with local and state organizations. Our PI is Dr. Jinhee Kim, and I believe she's in the audience with us this afternoon. My name is Erin Artigiani, a ROTA co-director. Barbara Kerr, our digital media manager, and I will be the facilitators for this webinar. Maryland ROTA aims to strengthen the capacity of rural communities in Maryland by helping our communities identify, understand, and respond to the evolving opioid misuse crisis. Our multidisciplinary approach includes delivering evidence-based training and providing access to current information and local resources through the ROTA website, network, and webinars such as this. We encourage you to join our growing ROTA network to learn about best practices, access educational opportunities, ask questions of peers and experts, and share your local experiences. More information about Maryland ROTA and a link for joining our network are available at www.marylandrota.org. This webinar highlights the results of a needs assessment and gap analysis conducted on Maryland's Eastern Shore. Today, we are very excited to be joined by two presenters. Our first presenter will be Teresa Simmons, Director of the Center for Healthy Communities in the College of Health and Human Services at Salisbury University. She will be followed by Dr. Amy Habeger, Associate Professor in the Department of Social Work at Delaware State University. This webinar will be approximately 60 minutes long, and we encourage you to submit questions during and after the presentations. Please do not raise your hand, however. Instead, we ask that you post your questions in the Q&A box. We will hold a Q&A session after both of the presentations are complete. We will do our best to get to all of your questions this afternoon. A copy of the presenter's slides and a recording of this webinar will be made available on our website, which again is marylandrota.org. You can find the webinar page under the Services tab. Thanks again, and we hope you enjoy this webinar. Dr. Habeger and Dr. Simmons, turn it over to you.
So good afternoon, everyone. Thank you for joining us. And as was noted, this is a conversation or sharing information about a gap analysis done relating to Eastern Shore opioid use prevention and treatment services. So this was a grant-funded opportunity from HRSA, the Health Resources Services Administration, under grant number G25RH32472. And the information and conclusions and opinions that come out of this are from us, and they are not endorsed by HRSA. So here we have a map of the Eastern Shore, which is very rural, as you can see. So it is the peninsula of Maryland, east of the Chesapeake Bay. 7 of the counties on Maryland's rural Eastern Shore meet the HRSA designation of rural. Those counties are Caroline, Dorchester, Kent, Queen Anne, Somerset, Talbot, and Worcester. So here we have the map that shows complete rural designations. And then we also have some counties that are partially rural. The total 2010 census for the Eastern Shore was 449,226. Health and poverty. All counties except Queen Anne's are shown to have higher poverty and higher rates of those aged 65 and younger who do not have health insurance. Almost 1/4 of Somerset County's population is living in poverty, which is more than double the poverty rate for the state. We also have a lack of access to buprenorphine and outpatient substance use disorder treatment providers in Maryland. The state of Maryland itself has 643 registered buprenorphine physicians. However, only 14 of those are located on the Eastern Shore within the designated rural catchment area. The limited number of registered prescribers, coupled with the lack of transportation that exists on the Eastern Shore, greatly impact access to treatment for residents. High opioid intoxication deaths remain a large concern for the nation state and also within the Eastern Shore region. Additionally, concerns with the COVID-19 pandemic, social distancing, isolation, that all leads to concerns with potential rises in opioid use and also overdoses. And it's also impacted the services available to people who need those services in terms of social distancing and access, transportation, all of that. That's had an impact on the Eastern Shore.
The overall goal of this study was to inform the creation of a plan to reduce the overall morbidity and mortality associated with opioid overdoses through the collection of data from the various systems that are impacted by the opioid crisis on Maryland's rural Eastern Shore. The exploratory research questions we addressed are contained on this slide, and they were: what are the opportunities and gaps in the rural service region for prevention activities? What are the available treatment services within the rural service region? What barriers exist to accessing opioid use disorder and substance use disorder care within the target service area? What are the training needs for the workforce in the rural service region? And what opioid use disorder resources currently exist within the rural service region that could be leveraged to achieve a reduction in the morbidity and the mortality associated with opioid overdoses? So to review and to answer those research questions, we came up with a kind of four-prong approach for data collection. So we reviewed existing data throughout the region, artifact analysis, community survey, and also key informant focus groups were completed. And I'll tell you a little bit more about each one of those plans on the next couple slides. So we recognized that multiple agencies, task forces, and work groups across the region had already vested an incredible amount of time and resources into studying and planning for addressing the opioid crisis. We conducted an artifact analysis of publicly available documents throughout the region. We reviewed 32 websites looking for publicly available documents and identified 13 documents for thematic review. The types of documents that we reviewed included strategic plans, needs assessments, task force and community meeting summaries, and also agency and county websites. Existing descriptive data was also pulled from a variety of online sources, including SAMHSA, HRSA, state reporting data, and local reports from health departments and hospitals as relevant to the population demographics, service needs, and also descriptors of the workforce throughout the region. This data was used to descriptively to report on the population and also to continue to establish the need. We also conducted key informant focus groups with key stakeholders from a variety of roles and industries across the region. We recruited them to participate in focus groups, which we scheduled regionally with the hope to reduce transportation and attendance barriers. As Teresa mentioned earlier, when she posted the slide of the Eastern Shore, it's a very spread out region. And so we wanted to make sure that we could, as much as possible, go to the key stakeholders and not expect everyone to come to us as we were conducting the focus groups. The focus groups utilized a semi-structured interview guide, and they lasted on average about 90 minutes each, with a total of 34 participants. Informed consents were received from all participants prior to their participation. The focus groups were all facilitated by the same researcher who had prior training and experience in focus group facilitation to maintain consistency. Backup notes were taken by a second researcher, and the group discussions were recorded and transcribed verbatim. All identifying information was scrubbed from the transcripts, and they were reviewed by 2 blind coders for inter-rater reliability, and themes and trends were then identified. As the focus of the study was to obtain perceptions from the entire community, we wanted to make sure that we also included a community survey component in our research plan. The survey that we utilized was adapted from Trudeau's Community Readiness Survey. And this was ultimately created originally for coalitions to use to explore community perceptions related to prescription opioid use and misuse. The instrument is publicly available with the intent of community-specific coalitions adapting and using it for assessment and planning purposes. The adaptations were further informed by the findings from our focus group discussions. Our study utilized snowball sampling through email and public media participation invitations to try to increase participation in the community survey. All participants clicked their assent to study participation before they started the electronic survey, which took approximately 10 minutes to complete. 337 individuals who either lived or worked in one of the counties in the target region completed the survey while it was deployed. Given the exploratory nature of the research questions, analysis was completed at the descriptive level for the community survey. The focus group participants consisted of 8 males and 26 females, and they represented all 7 targeted rural Eastern Shore counties. Our participants included 15 administrators and 18 direct service workers from a wide variety of service sectors. And on this slide, you can see the different industries which were reflected by the participants in the focus groups. For our community survey, most of the respondents identified their gender as female. 88% of the respondents identified their race and ethnicity as white or Caucasian. 6% identified as Black or African American. 2% identified as Asian. 1% identified as Hispanic or Latino. 2% selected other, and 1% did not identify their race or ethnicity on the survey. The ages of the respondents for the community survey were spread throughout the adult lifespan, and 3/4 of respondents reported possessing an educational degree at the bachelor's level or beyond. Respondents in the community survey reported both their county of residence and also their current county of employment. And it's recognized, we did this because it's recognized in rural areas that many individuals cross county lines and sometimes state lines for their employment. So there's some crossover between counties. So we wanted to collect data on the respondents as far as where they lived and where they worked. And so this slide shows the breakdown of counties and how many of the respondents were identified with each of the counties. So although the response rate varied between counties, all of the target counties were represented by the respondents on the community survey. To ensure that the sample was representative of the variety of groups in the community, respondents were asked to select all of their group affiliations. Respondents identified as being parents, being involved with the school, being involved with civic and volunteer groups, being involved with mental health and substance abuse agencies, the health professions, the business community, religious or fraternal organizations, youth serving and family advocacy organizations, social service agencies, the media, and law enforcement. So now we get to our findings. So these are, in the next few slides, kind of grouped related to the research question, but then also related to the mode of how we collected the data and what we found. So starting with the prevention opportunities and gaps in what we found on the community survey. The community survey gathered data on a variety of questions which were relevant to prevention opportunities and gaps. One of the questions queried the methods which were utilized to promote prevention events in the community related to reducing opioid use disorders, and another question focused on the ways in which respondents receive information on opioid issues in the community. The categories identified for each were, when we talk about how events are promoted, Folks identified social media as kind of the top way that events are promoted, along with local public media, print, such as newspapers, flyers, and postcards, and also the internet. So those were the main areas that on the community survey they identified that prevention events are being promoted. As far as identifying how they receive information, they tend to receive information through the media, word of mouth, and reports such as hospital reports, police reports, medical examiners, etc. So I think it's interesting when we look at these two, as far as how, the population is identifying that they're getting their information versus how we're promoting prevention activities. So it's, very important as you're starting to kind of think about takeaways from what we did and how it can be relevant to your local area, which we'll come back to in the end, is really thinking how the people in your community are receiving information and if that's the way that you're putting out the information that you want them to have. Additionally, we asked respondents to identify ways to improve attendance. We were really interested in attendance, as we all are, at community prevention events. What types of activities and events they thought are the most effective, and suggestions that they have for additional community activities or events to prevent opioid use disorders throughout the region. And some of the most widely mentioned response categories when we're talking about increased attendance, food came up a lot of mention of food and giveaways. I think those of us that are, planning events, we always think, okay, if we feed them, they will come. And that certainly was reflected in our survey with, suggestions on ways to increase attendance. Another way that was mentioned was providing transportation, making transportation available in some way. And then, of course, advertising and marketing, making sure that, the individuals that need to know about the event are aware that it's happening. And then lastly, in regards to increasing attendance, the location and the scheduling. You want to make sure that it's, certainly the event is held in a place that's convenient for the people that really would get the most benefit from being there, and that it's also scheduled at a time when they're most likely to be able to attend. So if, the target population that you're hoping to come to your event, tends to work evenings and weekends, then certainly scheduling on a Wednesday night at 6 o'clock, you may not get the folks that you're really trying to reach at your event. In regards to the most effective efforts that they identified in the community survey, they think that community health education was going very well, and efforts to reduce the number of scripts written and to increase knowledge related to safe storage and disposal were very helpful, as well as efforts which are specifically targeting the youth. They felt like that those were going well in their particular community. Suggestions that they had involved creating a community toolkit, targeting primary prevention. Even though they felt that targeting the youth was going well, that also came up in this particular category as well, continuing to target the youth, and also looking at workforce development and creating media campaigns focused on prevention. Focus group participants also identified opportunities and gaps related to prevention opportunities in several key areas. And for the focus group participants, those involved targeting youth and families. Youth continued to come up, and we'll come back to that later. Community health education, creating a community toolkit, increasing the availability of specific topics of services and specific types of services, media primary prevention campaigns, collaboration and coordination between programs, agencies, and jurisdictions, and reducing the availability of prescription drugs. And then when we looked at the artifact analysis that we did, we also found several key areas which we were able to pull out related to prevention opportunities and gaps. And these included anti-stigma opportunities and then just increasing general knowledge related to prevention and related to preventing opioid use disorders. Industry-specific targeted campaigns, and these related to restaurant workers. So on the eastern side of the eastern shore, we have the Atlantic Ocean, so we have Ocean City. And we know there's, high use, high concern with opioid use in the restaurant industry. So targeting the restaurant industry. And then we also had some suggestions which came up related to the waterman culture and the kind of increasing use of substances and opioids in the waterman industry. So those were the two industries that came up as far as, kind of targeting with specific campaigns towards prevention. Safe storage and disposal, of course, frequently continues to come up. Target populations, youth and families, again. Public health surveillance system, kind of increasing the public health surveillance system and the kind of real-time availability of statistics and numbers for tracking purposes, and also increased communication between the community and prescribers. When we look at the treatment service gaps, so we were looking at prevention, and now we're going to kind of shift to treatment services and look at gaps related to treatment services. Within our artifact analysis, we noted treatment gaps related to the area of kind of two different focuses. We saw gaps related to the type of service and also gaps related to a specific population, which may be facing gaps. So as far as service types, we certainly saw case management and care coordination mentioned in our artifact analysis, peer support, medication-assisted treatment, integrated harm reduction, and also increased availability of recovery housing throughout the region. And then some of the populations which were mentioned as far as service gaps were looking at treatment throughout the lifespan, that it seemed like treatment may target certain cohorts within certain age cohorts within the population and not looking at the entire lifespan. Youth was also mentioned, justice informed or detained individuals was mentioned, and individuals with dual diagnosis needs related to treatment. Focus group participants also discussed treatment service gaps and access barriers on the Eastern Shore, and they identified service gaps which were related to workforce shortages and organizational difficulties in the recruitment and retention of a workforce trained and skilled in reducing opioid use disorders and overdoses. Additionally, they identified shortages in specific types of services throughout the continuum, such as the need for 24-hour staffing for crisis and peer support services. Participants discussed service saturation in certain areas, which then leads to gaps in other service areas. So they mentioned, we have kind of some service hubs on the shore. There's a kind of concentration of services in Salisbury, concentration of services in Easton, Cambridge, some of the larger towns. However, as we are a rural area, things are so spread out. It's not always easy for individuals to get to that town or that city to access those services. And especially when we think about the inconsistency in the availability of public transportation on the shore, it becomes quite a concern. The most common gap-related issues on the community survey were the service continuum in general and the need to expand that service continuum and to add more services within the continuum. The need for additional peer support and expanded youth services. We keep coming back to peer support and youth services. And then we also have treatment access barriers. So we found service access barriers that were discussed by focus group participants. And, they were concerned that certain services were not provided. It goes back to what we just mentioned as far as increasing that service continuum. They felt like some types of services that were needed were not available. The focus groups also talked about transportation and location, which we just talked about on the last slide a little bit, with services being concentrated in one area, but then individuals maybe living in another area and having difficulty accessing the transportation to get to where the services were. Cultural barriers negatively impacting services. Certainly when we're thinking about rural areas and we're thinking about stigmas towards asking for and receiving help. And also, different concerns with confidentiality in a rural area. Maybe your provider maintains your confidentiality, but, if there's only one treatment service provider in your town and someone sees your car parked out in front, then, they certainly can tell why you're there. So, some kind of concerns with stigma and cultural barriers. There was also concerns with communication and collaboration between agencies, that they felt like there was challenge communicating between providers, and that folks may feel a little bit of that frustration of not being able to get that coordinated care that they're hoping for. And then difficulties with funding and provider reimbursement. Certainly there's only a certain amount of funds to go around, and kind of everyone's scrabbling for the same amount of funding or grants that are out there, and low rates for provider reimbursement. On the community survey, the treatment access barriers which were mentioned included transportation, a shortage of services, accessibility of services, increased wait times, and also concerns regarding potential disparities in the quality of care for publicly available services versus private reimbursed services or third-party pay services. Artifact analysis, looking at strategic plans, looking at, things which were mentioned in summaries and reports, continued to mention the difficulty with transportation, the lack of access to transportation, challenges with insurance and reimbursement, stigma, shortages in the workforce, difficulties in getting and maintaining a qualified workforce, challenges with sharing information between agencies, and funding difficulties. We also questioned regarding opioid use disorder workforce training needs, and the community survey question responses related to workforce training needs identified several common needs, which included the need for cross-training between disciplines and getting individuals to work outside of their silos, getting information on locally available resources and services, and making sure that kind of all providers were aware of those types of resources. If an individual is going to go to their primary care provider as kind of their point of entry to mention, that they have some personal concerns regarding substance use or opioid use, you want to make sure that that primary care provider is aware of all of the resources in the continuum of care that's available for that client, so that they're not getting incorrect information, which is that outreach to the primary care providers. The need for evidence-based practice trainings and certification for current treatment providers, more training on models and interventions, such as the stages of change, SBIRT, harm reduction, and motivational interviewing, making Narcan more readily available in the community, those trainings on how to administer Narcan, and methods to reduce prescriptions and increase the use of alternate pain management techniques. So, making sure that resources are there to give individuals alternative methods of coping with pain, and trying to work with prescribers to reduce the number of opioids which are prescribed. And then within artifact analysis, topics which came up related to the workforce training needs related to opioid use disorders, specific training topics, as we had mentioned, additional funding, and more community education. The focus groups also discussed the workforce training needs related to opioid use disorders. They discussed concerns related to the workforce shortage, difficulties with the recruitment and the retention of a trained workforce, and also the lack of funding for workforce trainings. And some themes which came out related to workforce training included specific topics, such as harm reduction, trauma, the Dartmouth model of integration, communication after EMS revival. It was interesting for us to note, we talked to a couple of first responders in different counties, and the policies within those counties differed as far as what they were supposed to do if they responded to a scene and they revived someone. Some counties, the procedure was they had to take that individual to the emergency room. In other counties, if they were revived, the individual could make the choice that they did not want to go. So, you know, teaching them in those, you know, first critical moments after the revival, some different ways to communicate with that individual, to show care and to begin to, you know, discuss that treatment is an option for them. Family work, life skills, and also red flags. There were also some disciplines which were mentioned as being great examples for professional development trainings, and those included prescribers, medical staff, teachers, educational staff, EMS, first responders, community members, office staff, and social workers. The types of trainings, they discussed the importance of offering local certifications relevant to opioid use disorder prevention, and the importance of focusing on evidence-based practices in the trainings that are provided. Participants also discussed attracting national expert speakers on relevant topics to the Eastern Shore and integrating opioid use disorder prevention and treatment competencies into higher education courses for health and education related disciplines. They had suggestions as well within the focus groups regarding workforce training needs. They discussed creating an interdisciplinary intern placement program, creating an Eastern Shore office to collect and share information throughout the region, locating funding for attendance at national conferences, providing professional meet and greet opportunities for current treatment providers and prevention professionals. And those opportunities should include award and recognition for those professionals who've been excelling in prevention and treatment efforts. So they talked about, you know, this need to recognize what's being done and recognize the individuals who are putting their heart and soul into this type of work. And these events can increase professional identification with an interdisciplinary community, this idea of increasing the holistic care available to individuals seeking services and helping the professionals who are serving them identify as part of a larger team within the community to address the regional opioid crisis. It was clear through all of the data collection methods that there's pockets of dedicated individuals addressing the opioid crisis already throughout the region. And many of those agencies and groups are already engaged in planning throughout their county and their small region. And opportunities exist to link these groups into a larger entity to share resources, knowledge, and lessons learned through previous efforts. There are abundant resource leverage opportunities, as was evident throughout the data collection from the focus groups, the community surveys, and the artifact analysis. The focus group respondents specifically talked about learning from county-specific resources and partnerships in other regions. We had certain pockets within the Eastern Shore who had strong partnerships within their county with a variety of agencies, and they were really making headway. And so, you know, the focus groups talked about, you know, the importance of studying other counties and what was working well and looking at lessons learned. And then also it was mentioned, you know, that we have universities and colleges available locally for additional training and workforce development opportunities, and the importance of creating those university community partnerships towards meeting the needs. Throughout all the community survey responses, the importance of partnerships and collaborations were continually noted, which supports what was mentioned in the focus groups. And the artifact analysis also led to a grouping of resource leverage opportunities, and those fell into 3 categories: communication and partnerships, activities and events, and treatment services. So, recognizing that those partnerships and collaboration efforts are out there and being creative and identifying those, and partnering on activities. Since, so many places mention that funding is limited, seeking partnerships wherever you can to stretch the funding to reach as many people as you can. And then also, of course, increasing the treatment services available. And Teresa, I'll turn it back over to you.
Thank you. So recommendations related to the information that we found: prevention activities targeting youth all the way down to the preschool age. So not just starting at that middle school age, but starting very, very young. Developmentally appropriate prevention activities should be delivered throughout the educational continuum, beginning with early childhood education. That can be done through school partnerships that are already in existence in order to infuse evidence-based prevention activities into all classrooms throughout the region. And one of those programs is BOTVIN, if anyone's familiar with it. Utilizing public health and community health education college students in order to complete their practicum rotations to assist the region with implementing that, and then utilizing early childhood education programs to expand social and emotional wellness curriculums to include age-appropriate healthy behavior choices education, and then creating a community toolkit of opioid use disorder prevention activities and strategies that are specific to the Eastern Shore region so that people know the services that are out there available for them. SAMHSA and HHS provide resources and guidance on developing these community resource toolkits. And so that's something that can include elements related to community health education topics, types of events and planning considerations that are going on, youth-specific prevention strategies, safe disposal locations, and a preferred speaker list, among other things, just so that people have the information that they need. And then one of the next things was increasing workforce development opportunities. It was very loud and clear that our local and regional agencies need support to hire a diverse and competent workforce that is skilled in best practices related to prevention, assessment, and treatment of substance-related disorders across service seekers, and then developing a continuing education structure to provide continuous training and education and awareness in order, and with additional certifications related to the newest research and evidence-based practices for a variety of resources and a variety of disciplines. And then targeted outreach efforts for the high schools, the community colleges, and universities in order to recruit students into these professions that will help support and provide SUD prevention and treatment. And then to increase communication between disciplines, a pilot interdisciplinary intern cohort program could be developed throughout the region for health and substance use related disciplines. And there are some grant funded models out there where this is an option and it's been effective. So exploring those opportunities. Modeling this group at the student level will encourage collaborative communication between disciplines and also foster a better understanding of the unique role of each profession in supporting prevention and recovery efforts within the rural areas. And then launching a regional media delivered health communication campaign is also helpful to make sure that we have consistent data tracking and monitoring. That was an ongoing issue that came up in our assessment that we did, so that we want people to have accurate numbers and accurate information, and to be sure that what we're sharing out is accurate. And so just kind of looking at that. And then recognizing and building on strengths and existing partnerships. That's critical in a rural area because resources are short and they are spread widely. They're hard to access sometimes. And so just really working together to do different pieces of different initiatives and to work together to share resources in order to provide the best services to our constituents within our communities, because that's what it's really all about. So some other things that we have done, that Salisbury University has done, is we were awarded a HRSA Opioid Impacted Family Support Program grant over the summer, which will allow us to provide training for community health workers as a paraprofessionals that will give them the skill set to work with families and children impacted by substance use disorders and opioid use disorders. So we're really excited about that. That will start. We're getting ready to roll that out. Our first cohort will start in February for that. And then continuing to seek grant funding for additional programs. And then working within our communities to build partnerships and to understand the need and to figure out how to best support them and to understand how to best educate our students. We also applied for, and we don't know if we received it yet, funding to develop an adolescent clubhouse, which will provide some support to youth ages 12 to 17. So it doesn't go all the way down to the early childhood mental health population, but it does catch that 12 to 17 age range. And so that's another thing that we have looked into, and we're hoping that we were awarded. So again, and then just building on and respecting the work that's already been done, because there has been a lot of work done. And so just recognizing that and continuing to build those partnerships.
And this slide just contains our contact information for Teresa and myself, and also Dr. Sherry Maykrantz in the public health department, or in the exercise sciences department.
Community health. She's
yes,
community health.
Community health, sorry. At my university, it's public health. Yes, exactly. So our contact information is here if you would like to contact us. And then the final slide just has some of the resources that we use throughout the presentation. And I'll turn it back over to Erin. I think she's going to monitor for questions.
All right, thank you so much, Ms. Simmons and Dr. Habeger. We really appreciate your presentation this afternoon, and you shared a wealth of information and some great recommendations for people from communities in Maryland and rural communities and other places as well. And I can tell that you've already engendered a lot of thought about the topic, because we're starting to get questions in already. So I just want to remind folks that you can submit your questions through the Q&A box, and we will switch over to that direction now. I do want to make one comment, and that was that Ms. Simmons was mentioning other kinds of trainings and programs that could be of interest, and one of them was the BOTFIN Life Skills program, and that is something that is offered through Maryland Rhoda. So you may want to check out the Maryland Rhoda website, marylandrhoda.org, and look under the services tab. And you can find more information about BOTFIN there, and also other services like mental health first aid and some upcoming community information sessions as well. And so switching into questions now, we have a number coming in. So I'll start with this one. For promoting community events, what did you find was the most effective local media to use?
As far as the types of events that seem to be the most useful, certainly, activities which had events for all ages, and, they continued to mention food. That seemed to be a big one, and also transportation access. They also seemed to, in the responses that we got, seemed very positive whenever they were speakers, inspirational speakers, or individuals who were telling their personal story. There seemed to be an interest, in thinking about these local activities to try to, bring in a statewide inspirational speaker, or a national inspirational speaker, something that would kind of bring a draw. This idea that, folks would come to listen to this, but then they'd also be available to receive all the other information which was available to them. And as far as media. That's I guess a little more clarification in the question and what if they're asking on type of media and promoting the activity.
Well,
I'll
I
just
know,
add one other thought about the food part. So a lot of grant funding does not allow you to provide food. So it really becomes creative, or it really becomes necessary to be creative in developing community partnerships with your faith-based leaders, churches, other community agencies who might be willing and able to cover the cost of food, because HRSA doesn't allow you to cover food. And that does get people there, especially if you have a 5:30 start time and you want people to come after they've gotten off work and they've picked their kids up. They expect to be fed, because when they go home, they need to then do the bedtime routine. So that definitely was a huge theme, just something to consider.
is there a way the average person can get involved to help their community?
I would say yes. I would think that a lot of agencies are looking for volunteers. I mean, even like Al-Anon or AA and those types of services look for people to help provide transportation, mentoring. So just reaching out to your churches. I know, I think it's in Caroline County, there's some churches that allow people who are coming they have a mobile van there. And so the churches allow the people who are going to be seen to sit in the church while they're waiting to be seen. So they're not outside in the elements. So yes, absolutely. It's just kind of looking to see what's available within your community and figuring out what's the best fit for you.
And I think many communities have like a kind of a hub for volunteerism, and maybe, trying to find kind of where that contact is in your agency within your county to find out, agencies that may be looking for volunteers or specific events that may be coming up that they're looking for volunteers to help with. But there should be, maybe through the local health department or through the local hospital, some type of kind of volunteer coordinator, which could be a good first point of entry for questions.
Yeah, you might want to look, for instance, for your local county prevention coordinator or someone like that at the health department, and I'm sure they'll be able to direct you as well, fill you in on what kinds of events and opportunities are coming up. All right, our next question is from somebody who is interested in finding out how organizations have been able to adapt during COVID. Do you guys have any information on that? Have you heard any stories about how things may have become more virtual or changes that may have occurred in getting syringes and medications to people and folks like that?
I can't speak to syringes and medications, but I know that there are a lot of virtual telehealth like groups and individual sessions going on, which of course can be a barrier on the Eastern Shore of Maryland because we have huge pockets of areas that don't have Wi-Fi or internet access or even cellular phone access. So I think that's probably been a challenge, but I think that's how they've risen to meet the need. And that's the best I know.
Okay, thank you. That was helpful.
I would agree with Teresa, and I would say also it seems like agencies are adapting kind of based on what their service is and the needs of their particular population. So I think agencies that feel like, their population is more adaptive to teleservices or have kind of gone in that way, whereas you have other agencies where if that's not really an option, then they're doing everything they can to find alternative ways of still providing that same service any way that they can. But I think, agencies certainly have struggled.
All right, thank you. So one of our viewers asked about the webinar and if it would be available for viewing at a later time. So yes, it will. It will be posted on the marylandrota.org website along with a copy of the slides. So I hope you will be able to look at it then or share it with your friends and colleagues. And moving on to the next question. I don't know if you'll have a lot to offer on this one, but it's a good question, so I'm going to throw it out. And that is, what are some of the challenges you are facing in testing for substance abuse with the rural communities? Do you have any thoughts on overcoming those challenges? Okay. So we'll look around and see if we can find some information on that topic in other ways that we could share through the Rhoda network. And we have one more question here, which gets back to what you were talking about earlier, which is from somebody who would like to know how organizations have been able to promote events and programs during the pandemic. So I know from Rhoda's perspective, we've done it through the Rhoda network and also through the Caesar Research Network, which you can easily join from either the Maryland Rhoda website or the caesar.umd.edu website and be a part of the conversation that way. I'm sure there are other networks and listservs that people have and other ways as well through online advertising and billboards and things like that. But do either of you have anything to jump in with?
I would just reiterate what you said. There are several listservs, and I have seen a huge increase in virtual events and a lot of events that are virtual and free that you would have paid for in the past, just trying to keep people engaged and to share the information. I'm trying to think off the top. I can't think of any one specific off the top of my head that might be helpful. But I think if you just were to Google like listservs for opioid use disorders or substance use disorders, you would come up with a whole long list. And like you said, Rhoda is a good resource as well.
All right. Well, on that note, thank you so much. And we really appreciate both of you joining us today and all of you who were here as participants as well and all of the questions that you sent in. I think we had a good discussion this afternoon, and we hope we'll see all of you again for our next webinar in February. And we will be posting more information about that soon on the Maryland Rhoda website and the network. So thank you, everyone, and have a good day.